Hi, we're talking about COVID-19 vaccine and infertility and pregnancy today. My name is Serena Chen. I'm a physician, a fertility specialist, reproductive endocrinologist at the Institute for Reproductive Medicine and Science at St. Barnabas in Livingston, New Jersey. And I'm talking here at the IVF Babel Conference. It's January 2021. I think that's very important because with COVID-19, we have to put a date on it because things are changing so rapidly. So I'm going to tell you what I know about the COVID-19 vaccine, what I've been telling my patients, and the things we've been talking about, some of the questions they're having. Hopefully I'll answer for you today because I want you to have as much information as I have so that you can make an informed decision for yourself. I'm not going to tell you what to do. I want this to be a chance for you to learn something about the vaccine, to learn about what a lot of fertility specialists think about the vaccine and the things we are talking with our patients about and the things that inform the decision making. Ultimately, you will talk with your doctor so that you're comfortable and you can make a decision that's right for you in your own situation about whether or not to get the vaccine. So the COVID-19 vaccine has just been authorized for emergency use in the United States, and that's happening all around the world. There are multiple different vaccines. In the United States right now, we have the Pfizer and the Moderna vaccines, which are mRNA vaccines, which have just been authorized for emergency use in the general population. The ACIP, which is our Immunization Advisory Committee, ACOG, American College of OBGYN, ASRM, the American Society for Reproductive Medicine, that's all us fertility specialists in the United States, and SMFM, the Society for Maternal Fetal Medicine. So these are national societies that make recommendations about things like what's safe to do in pregnancy and for people trying to conceive and what's not safe to do. And all of those bodies every year recommend very strongly that pregnant women or women trying to conceive get the flu vaccine because we know the flu vaccine is safe in that circumstance. It's been used in many years, and that the risk of the flu can be very deadly in pregnancy. So we really strongly feel that the benefits of the flu vaccine outweigh the risks. We also feel that for most people during this COVID-19 coronavirus pandemic that is seems to be spreading wildly out of control, that for many, many people, the benefits of the vaccine outweigh the risks. And we feel that this is mostly true for people trying to conceive and pregnant. Now, how can that be? The vaccine has not been studied extensively in pregnancy, so there's not a lot of real life data. How can we say those things? Well, we do know that COVID-19 can be really dangerous for pregnant women. We know that if you're pregnant, you're much more likely to get severe disease if you get infected with the coronavirus than if you're non-pregnant. So the risks of COVID-19 in pregnancy are much higher than when you're non-pregnant. And that means what we're seeing, we aren't seeing a higher rate of mortality. We aren't seeing higher rates of death like we do with the flu, although obviously we're still collecting data that could change. But it definitely seems that pregnant women with COVID-19 are much more likely to end up hospitalized and much more likely to end up on a ventilator. So this can be dangerous for both the mom and the baby. So it does seem like just like the rest of the population, COVID-19 can be very dangerous for pregnant women. Now, what do we know about the vaccines? Well, the mRNA vaccines, theoretically, what we know about the science and the physiology of these vaccines make us feel comfortable about the idea of using it in pregnancy, just the way the vaccine works. Now, I think that's going to be different for some of the other vaccines that are coming out. So the AstraZeneca vaccine and the Johnson & Johnson vaccines will most likely be the next two vaccines approved in the United States. And those are both live attenuated or live weakened virus vaccines. They use an adenovirus with a little piece of DNA to give to people, and the adenovirus helps the DNA to get into your cells. The DNA then uses your body apparatus to make messenger RNA. The messenger RNA then uses your body apparatus to make the proteins. When you make the proteins, you're making proteins, a little piece of protein that's the spike protein, a small component of the coronavirus that the virus uses to attach to your cells. So when your body makes this protein, which is a foreign protein, it doesn't make you sick because it's not the whole virus. It just makes this protein, but it does induce an immune response in your body, and your body will make antibodies and T cells that then, if you're exposed to the coronavirus, you already have this immune activation and you can fend off the virus. That's how a lot of vaccines work, is they teach your body how to ramp up the immune system against a particular agent, so that if you see that agent in the future, your body will already be prepared with the armor or the tools or the ammunition it needs to fight the infection. So AstraZeneca and Johnson & Johnson, not approved yet, but probably will be approved soon, because their live viral vaccines will be unlikely to be recommended in pregnant women. In general, we do not recommend anybody who's pregnant to get a live virus vaccine. And indeed, in my IVF patients, when they need a vaccine, like they need a rubella vaccine or a chickenpox vaccine, those are both live virus vaccines. And I want my patients to have that because both those diseases can be really severe in pregnancy. So what we do is say, go ahead and get the vaccine. Once you've had the vaccine, 30 days after you've had the vaccine, then it's safe to conceive, because then the live virus is no longer in your body. And something like that recommendation will probably be true for all live virus vaccines. Now, there are other types of vaccines out there, but these four vaccines, Moderna, Pfizer, mRNA vaccines, those are already approved. And then AstraZeneca and Johnson & Johnson probably will be the next two approved. Those are adenovirus vaccines. So let's talk about the ones that are approved. Moderna and Pfizer, both approved in the United States. We've already vaccinated millions of people, and we are recommending that pregnant women who may have exposure to coronavirus seriously consider getting the vaccine. And in fact, ACOG, ACIP, ASRM, and SMFM, all our national societies that advise physicians on how to treat pregnant women, are all saying it's very reasonable for pregnant women to get this vaccine despite the lack of data in pregnant women, given what we know about the science of the vaccine. So you get the mRNA shot, the Pfizer or the Moderna vaccine. There are two shots, and the Pfizer is 21 days apart, the Moderna is 28 days apart. The mRNA goes into your cells. It doesn't go into the nucleus. It stays in the cytoplasm. In the cytoplasm, your cell has all the machinery it needs to make proteins. And when it sees a piece of RNA, then the protein assembly just attaches to the mRNA and it makes the protein that the mRNA codes for. And these vaccines have mRNA that codes for a piece of the coronavirus spike protein. So it will not create a false positive on your testing. It will not give you COVID-19. You will not be infected. It's not a virus. It's just a small piece of the protein. But that protein is what the virus uses to attach or attack your body. So that if you are making this spike protein, your body will recognize this as foreign, and you will ramp up B cells and make antibodies against the spike protein, and you will ramp up T cells to create T cell immunity against the spike protein, so that if you're exposed to the coronavirus and you get infected with the coronavirus, your body already has the ammunition it needs to fight off the infection, even though you've never had the coronavirus before. So it will protect you. It should protect you against getting sick. And both these vaccines have been shown to be extremely effective at preventing people from getting sick. So we're thinking about 95% effective. We're also hoping that they prevent transmission and help us to end the pandemic. That data is still coming out, but it does seem promising. So because these are not live virus vaccines, we think that mRNA is a substance that's in everybody's body. You're making mRNA all the time, and it really should not cause an issue for trying to conceive, for pregnancy, or for breastfeeding. In fact, we don't really feel like the mRNA is going to go everywhere in your body. It goes in some cells. They start to make some proteins. The mRNA itself is rapidly degraded. So we really are not expecting this mRNA to actually get to the baby or get in the breast milk or get in your eggs or anything like that. There's nothing about the physiology of what we know about mRNA that would make that possible. Obviously, we don't know everything, and until it's fully studied, we don't know 100%. But given that we know the risk of coronavirus is so high for pregnant women, and the mRNA vaccine physiology appears to be very safe, we do feel like giving the vaccine to many pregnant women can be really safe. Now, I cannot tell you what to do. I am not your doctor. You definitely want to talk to your doctor. And there can be all kinds of other things going on. Like, what if you have another chronic condition where you take medicines, you get treatments? Is it okay to be pregnant with that condition and take the vaccine? We don't know. What if you take the first shot and then you get pregnant? Should you get the second shot? Right now, all the societies are saying it's perfectly reasonable to treat pregnant women just the same as you would treat everybody else with regard to the vaccine. So people with a history of severe anaphylaxis to injectable medications, severe anaphylaxis to anything should proceed with caution. Probably should talk to an allergist first. There aren't any other really big contraindications that I'm aware of, but I think from what I've seen with my patients that are at the front line, like my intensive care unit nurses and doctors, most of them have, read the information, and I've talked with them, and most of them are feeling comfortable and are getting the vaccine and are doing just fine so far. It's early, but they're doing just fine so far. And then I have some patients who are trying to get pregnant and they feel like, I'm I'm in the first trimester or I'm doing IVF, I'm already nervous. I don't really want to throw anything new in there. And I know that myself and everybody in my household, we've been really, really good about being able to shelter in place. I have a job where I can work from home. I'm really not exposed to the coronavirus. I always wear my mask, always wash my hands. Everybody around me is really careful. I feel like I can be really careful. And, so right now I feel like I would rather wait for more information. And I think both those options are perfectly reasonable. I think those are examples of people taking their individual situation into consideration, looking at what we know and what we don't know and what the general guidelines are, and talking with their doctor. So I encourage all of you to keep reading and learning more, because we're going to continue to get more and more information. And I'm sure the IVF Babble ladies, have resources where, you can find out from them where are good places where you're located to find information. In the United States, we are asking people to check with the CDC, to check with your doctor, and to check with some of these national societies. ASRM.org is a great resource for people who are going through infertility, fertility treatment, trying to conceive, and pregnant. So I'm hoping that we are going to learn more and more. So far, what we have is very reassuring. And I think we're very optimistic and excited about the availability of these vaccines, and do think that they're going to play a very big role in hopefully ending the pandemic. And meanwhile, we still feel that the essential goal of having a family and conceiving can go on safely during this time. But we do feel like, you might need help from your doctor, you might need advice. So please reach out to your physician. If you don't have one, IVF Babble can help you with that. I hope this was helpful. I think that it's important to know that you have to feel comfortable. So you should not be getting a vaccine if you're not comfortable, if you don't know a lot about it. We want you to get more information and make an informed decision. But all the experts and authorities do feel that for most pregnant women and most people going through infertility treatment or just trying to conceive, that the vaccine can be safe, the mRNA vaccines can be safely taken, and that it can be reasonable. Perhaps just one thing, very small portion of people will get a very high fever. If you're significantly over 100, you should call your doctor and consider taking something to lower your temperature, like that's safe during pregnancy and trying to conceive, which is usually Tylenol or acetaminophen, and tons of water. So for most people, lowering the temperature safely while they're pregnant or trying to conceive is usually acetaminophen. And fever, high fever does occur in a small number of people who are getting the vaccine. So that's something to be aware of. I hope this is helpful. Lots of information to take in. And please stay safe. Keep washing your hands. Wear a mask. Talk to your doctor. And stay safe and be well.